Portland is trying an out-of-the-box idea to curb the city's historic spike in gun violence, installing traffic barrels in hard-hit areas.
I'm glad that there's an initiative and, we're not doing anything.
So, are they stopping the shootings? Not according to the numbers.
I mean, no one's going to say, oh no, local access only, better not shoot here. Like, that's ridiculous.
Plus, the labor shortage is hitting hospitals hard, right in time for the expected Omicron surge.
We cannot afford to lose a single healthcare worker.
We have 800 open positions in our healthcare organization. Close to 200 of those are nurses.
One reason a lot of nurses are leaving? To earn more money in traveling gigs.
When we look at the impacts of the healthcare system, it's just profound.
Here's the story.
We've already gotten emails actually about that story. I'm Maggie Vespa. Welcome to The Story, the show where we want to know what you think about the things that we're covering. So contact info is always at the bottom of the screen to start off. You can email thestory@kgw.com. You can use that hashtag, TheStoryKGW. Our team is watching for your feedback as our show is on the air. So that in mind, let's get started. And we'll start with our big story, a couple of parts to this one, because today we got news that no one wants to hear. Oregon is once again bracing for a COVID surge, and it could be the worst one yet. This is a look at the forecast model for Omicron that OHSU released today, and this shows projected hospitalizations in Oregon from Omicron alone. This is just that variant. You can see that huge spike in January and February. And this model predicts more than 3,000 hospitalizations from the new variant at its peak. 3,000. That's more than twice as high as the number of people in the hospital with the Delta variant when that peaked in September. Now, this forecast says more boosters and other measures could bring these numbers down. But either way, researchers are not optimistic. And we realize this is really tough to hear, especially heading into the holidays. The timing is horrible. So here is what OHSU's chief medical officer said during a press conference with the governor today.
I'm sure that everyone hearing this news feels devastated and slightly overwhelmed to learn that we're facing another surge of people ill with COVID-19. Once again, many Oregonians will need a staffed hospital bed, which frankly remain in drastically short supply even now around the state. To be candid, this feels like another gut punch, particularly for healthcare workers who've been stretched truly beyond their limits. These extremely dedicated professionals are not easily phased, but after nearly 2 years on the front lines of this war, they're justifiably worn out and may well feel defeated in the face of another wave of patients sick with COVID-19.
They're justifiably worn out. That was how she put it. So during that press conference, officials also talked, because of that, about bringing in more travel nurses to help with the expected Omicron surge. It just so happens we've been exploring why that's a necessary step to keep hospitals open. And as Ashley Korsland found out, the large pay difference between those traveling nurses and local staff nurses is causing a lot of frustration because the travel workers are making upwards of 4 times the amount of money.
If you're a healthcare worker looking for a job, you've likely seen ads online like these. Travel nursing positions offering $5,000, $6,000, sometimes $7,000 a week.
The healthcare system is broken.
And you'll see videos all over social media.
Our COVID numbers are rising, and I've already complained about how overwhelmed this is getting.
It is so not normal to hate your job like that, to cry before your shift.
Nurses talking about quitting their staff hospital jobs for lucrative travel gigs. These travel nurses fill gaps in staffing at hospitals for specific periods of time, sometimes for just a few weeks.
And it's a game changer. It's a huge world of difference. I mean, the amount of respect you get, insane.
But this growing trend has created a tricky dynamic between the traveling workers and permanent staff nurses in hospitals.
It is such a large problem on many levels. We're becoming way too dependent upon travelers, and it's not a functional system for how you staff a hospital. Or
Matt Calzia with the Oregon Nurses Association says travel nurses play an important role, but they can make 3 to 4 times what a staff nurse makes.
Are you hearing from staff nurses about this, and what are their feelings on that wage discrepancy between what they make and the travel nurses make?
So our members with ONA there's a lot of frustration around. Our members are not feeling valued by their employers.
The problem is complicated. The pandemic exacerbated an already critical nurse shortage nationwide, with nurse burnout reaching record levels. A recent poll from OHSU showed 60% of its nurses are considering leaving the profession. And because of the shortage, hospitals are in a tough spot for staffing. That's where travel nurses come into play. Hospitals can hire directly through agencies. The state also has several contracts with staffing companies. According to the Oregon Health Authority, as of early November, the state had almost 1,000 contract healthcare workers in hospitals and other clinics. In late November, Oregon extended the expiring contract for Jo Ann Health through January of 2022. We looked into the contracts for 3 of the companies providing emergency staffing in Oregon, including Jo Ann. They bill the state based on an hourly rate. The rates in Jo Ann's contract, for example, include travel, lodging, and per diem. On the high end, an ICU nurse can cost up to $237 an hour. A registered nurse, $204 an hour. For comparison, according to the Oregon Nurses Association, the average salary for an RN in Oregon is around $80,000 a year. That's a pay rate of just over $40 an hour.
The travel nurse phenomenon is a Band-Aid at the end of the day.
Dr. Iman Abuzaid is the CEO of Incredible Health, a career marketplace for healthcare workers. She helps match and place staff nurses in hospitals nationwide. According to Incredible Health, 80% of hospitals have reported an increase in permanent nurse turnover during the pandemic. That's not just because of burnout, though, but early retirements, career advancement opportunities, and the fallout from vaccine mandates.
What we're seeing is that 20% of nurses across the country have chosen not to get the vaccine. What that has created is even more turmoil in the market when it comes to making nurse hiring and nurse retention happen.
We don't really know how many nurses in Oregon were fired over the mandate. There's no statewide agency that kept track. Neither did the Hospital Association nor the Nurses Association. Abuzaid says the cost associated with travel workers isn't sustainable. Most hospitals, she says, can only afford about 5% of their workforce to be temporary. Many are topping 20% right now.
It's a cost issue. Hospitals run on low margins, and when you are spending 3 to 4 times on your temporary labor, that is going to eat into what is already your low margins.
Make the work environment better. And
the Oregon Nurses Association is now calling on hospitals to stop relying on travel nurses out of fear that more staff nurses will continue quitting to take these higher paying positions.
When we look at the impacts of the healthcare system, it's just profound.
Okay, KGW's Ashley Korslund joining me now. And so such a complex problem and a lot of different vantage points to look at. You did talk, as we saw, to the Oregon Nurses Association, that's the union. And I'm wondering if they presented any sort of possible solutions or things that they would like to happen to address this.
Yeah, you know, they actually did. And so the spokesperson I talked to said it's not just about pay. That is part of the equation, right? That they'd like to see higher wages for nurses. But part of it, they would like to see more retention programs to keep the nurses they have. So that could look like having better access to mental health resources. Another thing is that they want more career advancement opportunities and trainings for people to move up in their respective fields. One other thing, they are asking the state of Oregon and the governor to kind of establish a team that could go and examine the state's healthcare staffing shortage, really take a complex look at it and come up with solutions.
Gotcha. And speaking of, you and I were talking before, and we heard from her today. You did reach out to Governor Kate Brown's office about this. What did they say?
Well, we haven't heard back yet.
Okay.
So when we do, we will, of course, pass that along to you. You know, this is a really complicated topic. It's not going away, this problem, anytime soon. And so we will be continuing to follow this story, and we'll bring you updates here as people do work for solutions on it.
All right. Ashley, great story. Thank you so much.
Thanks.
Switching gears here, a few months ago, you might have seen Portland City Commissioner Jo Ann Hardesty ordered road crews to install orange traffic barrels to help curb gun violence. It definitely got a lot of people talking, but frankly, we wanted to know, is it working? Here's Kyla Boshi.
We've spent a lot of time talking about Portland's gun violence and how there's no easy solution. Over the past few months, city leaders have devoted millions of dollars to help support community groups and tried to create a team of officers to spend more time on the street. So far, they're not up and running yet. To date, the most visible response has been this: orange barrels. In October, Portland City Commissioner Jo Ann Hardesty ordered city crews to install traffic barrels in one Portland neighborhood that has been plagued by shootings, which got us wondering, have the traffic barrels worked? It's still early, but so far, no, they haven't worked. Many neighbors complain the orange barrels have done little to curb gun violence.
You know, it's almost on a nightly basis. There's gunshots, there's racing, definitely.
Shootings linked to high-speed drivers in the Mount Scott-Arleta neighborhood continue. As proof, just listen to this shooting captured on a home security camera in late October. Commissioner Hardesty ordered the Portland Bureau of Transportation to install these traffic calming devices across a 6-block area in the Mount Scott-Arleta neighborhood after residents complained about a spike in shootings this summer. The goal was to deter the speeding and other criminal activity in this hotspot, along with the shootings. Hardesty explained, "This is an all-hands-on-deck situation where government needs to dig deep, think creatively, and directly engage community members to develop shared solutions that improve community safety." The strategy got mixed reviews. Some neighbors were encouraged by the response.
I'm glad that there's an initiative and, we're not doing anything.
While others mocked the idea.
I mean, no one's going to say, oh no, local access only, better not shoot here. Like, that's ridiculous.
For a closer look, we zeroed in on the area surrounding the traffic barrels in the Mount Scott-Arleta neighborhood. Then asked the Portland Bureau of Emergency Communications, which runs 911 dispatch, to break down calls. In the 2 months prior to the installation of traffic barrels, there were 42 shooting-related incidents. After the barrels went up, there were 45.
It's scary, but the sad thing is I'm getting numb to it. I'm like, I hear something, I'm like, oh, it's probably another shooting, but nothing's going to be done about it.
Another complaint among neighbors, high-speed drivers.
Yeah, I don't know what it is about these streets in particular, but I guess they just look like drag strips to some people.
We looked at those numbers too. Prior to the orange barrels, there were 40 reckless driving-related calls in the neighborhood. After, there were 39. Again, it's still early. The traffic barrels have only been out for 2 months.
I still really do like this neighborhood, and there's people racing during this interview, so...
To help evaluate this pilot program, Commissioner Hardesty's office recently started distributing a survey to neighbors. She explained, installing these barrels alone will not and is not intended to end all gun violence, crime, or speeding in your neighborhood. There is no one simple solution. Which most people would agree with. There is no simple solution. Gun violence is a complex issue. The question is, are city leaders moving fast enough to combat the problem? Kyle Aboshi, KGW News.
All right, still ahead, if you are a parent with a child in school, you've probably heard this week about threats going around, like possibly a lot of them, not just here in Oregon, but across the country.
It's really frustrating that it spreads and creates anxiety that doesn't need to be there, especially for our youngest students.
We're going to take a look at where these threats are coming from and what schools are doing when the story continues. Keep sending in those questions and comments to the story at kgw.com. I will say my producer just told me that someone wrote in asking us to explain TikTok. Ugh. Okay, so just know it's a social media platform where you post videos, make and post creative videos. Do not download it. It will drain hours from your life. That being said, this next story is really serious and it's tied to TikTok. We want to talk about something that if you're a parent or a student, I'm sure you're aware of this. School threats have been circulating online this week, and it's all tied to a nationwide social media challenge that started on TikTok. In fact, vague threats, specifically of school shootings and violence that were supposedly going to happen today. Like today was the day. They've been circulating on TikTok, on that app. And typically in these posts, individual districts aren't actually named. And to be clear, we have not heard of any threats that were actually credible. Still, it's caused a lot of anxiety, no surprise, among families and staff in multiple local districts, including Portland Public Schools. I talked to Christine Pitawanich about this earlier.
Okay, so Christine Pitawanich joining us now. So Christine, let's just start with, do schools know where these threats are coming from? And do we know if local kids are involved in this?
Well, it's kind of hard to determine exactly where these are coming from, right? These threats are happening nationwide, but local students may be unknowingly contributing to these when they share it on their own social media pages. In fact, I spoke with the head of security for Portland Public Schools, and she's asking students to not repost or share these social media threats because it may just increase the fear.
Gotcha. And then what else can you tell us about how schools are responding to this? Because this is so scary and it seems like it's coming at them, from all angles. So what are they doing?
Well, it appears a lot of school districts are handling it in a similar fashion. Many of them say they're working with local law enforcement. They also have their own internal investigations going on to try to pinpoint if any students have originated a post. But if a student is found to have been involved in creating a post and disseminating it, there are consequences. For instance, at Portland Public Schools, there may be some kind of disciplinary action and maybe some wraparound support services. The head of security that I spoke with at Portland Public Schools says in other parts of the country, she's also heard about prosecution.
Wow. And then I know in your reporting on education, you're great about, combing social media, and parents, have reached out to you on numerous occasions. So tied to this story, what are you hearing from parents?
Well, one parent I spoke to was just so frustrated with it. She has a child in high school and 2 kids in elementary school. She says her 4th grader was the one who was most affected by it, affected by these threats of school violence, of course, being shared on social media, specifically through TikTok.
People that he follows, young kids, talking about it. And so he was the one last night that was up and worried about going to school today.
Both that parent and district officials say it is up to everyone to keep schools safe. And for students, that means telling an adult if they notice something, hear something, see something that seems amiss. And for families, that means keeping tabs on kids' social media use.
All right. Christine Pitawanich for us. Christine, great information. Thank you.
All right, everybody, still ahead. If you head to the grocery store this weekend, and obviously it's a busy weekend for doing that, you might have to decide whether to cross a picket line or go somewhere else. We have a look at the beginning of the Fred Meyer and QFC strike when the story continues. Welcome back. When you do your grocery shopping this week, you are going to have to make a choice, frankly. Do you cross the picket line at Fred Meyer and/or QFC and spend your money there while workers are striking outside? Or do you go somewhere else? We're interested to hear your opinion, so send us an email. Let us know how you feel. The story at kgw.com. But just to catch you up, we talked about this last night, but it started this morning. Workers walked off the job around 6 a.m. this morning at Fred Meyer and QFC locations in Portland, Bend, Newburgh, and Klamath Falls. And they're planning to strike for at least a week unless their union reaches a deal with the parent company, Kroger. Now, the workers are represented by the United Food and Commercial Workers Union, Local 555, the chapter who says the workers voted overwhelmingly to strike earlier this week. So what do they want? Well, the union says workers need higher pay, wage transparency, and an end to what they're calling unfair labor practices by Kroger. They say they've been trying to negotiate for a new contract to lock in these demands since July. So this has been brewing for a while, almost half a year at this point. And the union says Fred Meyer has refused specifically to provide them with information about wage disparities, which they say is necessary for those negotiations.
These members deserve to be paid what they're owed, and they will not give us the information to be able to bargain the contract or settle those grievances.
Break it down in layman's terms for people at home. Are we talking wages? Are we talking health care? What are the issues?
Money. Wages. These people have worked through a pandemic. These people are still working through a pandemic. They had hazard pay. It's evaporated, but it doesn't exist. It doesn't exist anymore. These people are still serving their community.
So Fred Meyer, for its part, says they're still open for business, and they say the workers are, their word, reckless for striking during the holiday season. They say they proposed increasing pay and benefits for workers, but the union didn't like their proposal.
They really just walked away from the table. We had to hand the proposal to them and really ask them to take the proposal because they were ready to walk away and start this work stoppage. But if you go to fredmeyercba.com and look at the proposal, you can see the numbers are all there. For like a checker at a Fred Meyer, at your local Fred Meyer, for some of those checkers, it means a $3 and I think it was like 72 cents hour increase in their wages. And now, granted, not everyone's getting that, but it's significant investments in wages as well as pension and retirement and continuing their benefits.
So Fred Meyer has been trying to hire new temporary workers for this week, and they want people who they say are willing to cross the picket line, or obviously are willing to cross the picket line. We saw these signs posted outside stores, and then we saw online ads as well. We're told this strike will end at 12:01 a.m. Christmas Eve morning, unless both sides can reach a deal before then. But as it stands right now, there are no bargaining sessions on the calendar, and the strikers are frankly just hoping that you'll shop somewhere else.
We would strongly urge the community to not cross our picket line. You can shop at Safeways, you can shop at Albertsons, those are union all in the whole state of Oregon. But you know what? Do not cross the line. If you see picketers up, turn around, shop somewhere else.
We'll keep you posted on what happens with that strike. In the meantime, keep sending in your questions and your comments to the story at kgw.com. We're going to finish the show with some weird holiday decor. That's not going away, for better or for worse. That's coming up next. frankly, at this point, what would this show be this time of year without weird holiday decor? We need the weirdness, don't we? This one comes from Veronica, and it involves her weird cat. I mean that as a compliment. She wrote, quote, "Have to confess, this one is staged." Love the confession. But what cat doesn't love to play with the Christmas decorations? Elmer James Fudd. Amazing name for a cat. Elmer James Fudd was such a good sport about letting me put this on him for a cute, quick picture. He looks miserable. Like, I'm not gonna lie to you. He looks like he might be plotting a felony. But I love this so much. I love the fact that he let you do it, and I love the fact that you had the foresight to do it. So keep sending in those weird holiday decor pics to the story at kgw.com. Bonus points if your pets are in the photo. Extra bonus points if they have human names, because I love that so much. Thank you so much for joining us here on The Story. The news at 6:30 with Ashley Korsland is coming up next.
This is KGW News at 6:30.
Today, I'm calling on 1 million Oregonians to step up and get their booster dose by the end of January.
A call to action from Oregon's governor as health experts predict Omicron cases to surge. The latest forecast from OHSU has the COVID variant spreading quickly and overwhelming hospitals. Tim Gordon reports.
Omicron is here, and it is poised to hit Oregon hard. That was the message delivered at a Friday news conference led by Governor Kate Brown.
We only have a few weeks to prepare before Omicron hits our communities and healthcare systems in full force.
The governor noted that it was a year ago this week that COVID vaccines were first administered here, and a year later we face a second holiday season with the virus surging. OHSU's chief COVID forecaster expects we will follow countries like the UK and Denmark and see Omicron cases double every 2 or 3 days, quickly overtaking Delta as the dominant variant.
We can expect a surge in Oregon hospitalizations by mid-January, with infections that begin sooner than that. Combined with its heightened transmissibility, we expect Omicron will generate a large increase in the number of Oregonians who will become severely ill and likely need a hospital bed.
Dr. Graven did say that while Omicron may be the most transmissible yet, it does not appear to be as deadly as Delta. But just by sheer speed and volume, it will be hard to handle.
The OHSU forecast is telling us that a big wave is coming, and it threatens to be bigger than any wave we've seen before.
At its worst, Omicron could cause more than 3,000 to be hospitalized in Oregon at a peak in early February, compared to Delta's peak of 1,200 last September. But with a push of people getting vaccinated and boosted,